Sabrina has worked on over 18 clinical trials, and she is a wonderful, wonderful research nurse. She really knows how to get down to the questions that need to be asked. She does it well. She's the senior supervisory research nurse on our team, on our consortium for research in elder self-neglect of Texas. We are finding out through that research some very different things that may kind of change the face of the way we do things in elder self-neglect. And I think that Dr. Royal really alluded to it this morning when before lunch, when he said that executive function is playing a huge part in our decision making. And up until this time, that has not been the case. But I think you will see in the future that we're going to be relying more and more on executive function parameters rather than simply classifying someone as incapacitated or having dementia or some other condition. Sabrina has been a volunteer in Kazakhstan. She has a master's degree in nursing and a couple other degrees behind her name. I mentioned she's a nurse practitioner. She is a joy to work with and has brought a whole new dimension to our down in the trenches kind of attitude. You know what we think about those research people. But I'm so happy to introduce her, Sabrina Pickens.
Dr. Dyer actually wrote this module, so I'm going to try and represent her well. Module 5 covers neglect, which we're going to be discussing both caregiver neglect as well as self-neglect. Dr. Riley mentioned the CREST study that we're doing, and we're actually almost completed with it. We've enrolled 83 self-neglectors, confirmed cases from APS, and have matched them to 80 controls. And we're planning to enroll 100 in each arm. It's going to be the first study of its kind and looking at self-neglectors. The objectives for this module are to describe the neglect that occurs in the community, list the most commonly associated medical conditions associated with elder neglect, discuss the roles of the clinician in caring for patients with neglect, as well as review issues related to the right to self-determination in patients with and without capacity. Okay, we have 3 pre-test questions. Here's the first one. Self-neglect makes up what percentage of elder mistreatment cases? 10%, 20%, 30%, 40%, or 50%? I'm going to start out with a case of Mrs. J. This is a 70-year-old female seen by Adult Protective Services 3 weeks prior to this picture being taken. APS recognized that she had a medical need and actually recommended that she go see her primary care physician. She agreed to do so, yet she never went. After several days, her neighbor became concerned after not seeing Mrs. J in the house and called the paramedics. And she was eventually transported to the hospital where she was diagnosed with a hypothyroid coma and underwent treatment. Now, normally a caseworker probably wouldn't recognize that this was an urgent medical condition, but most clinicians would see that she had untreated hypothyroidism. She's missing the lateral thirds of her eyebrows, as well as having facial edema and a plethoric facies. Okay? And then this is her after undergoing life-saving treatment. As far as the outline, I'm going to be going over the definitions of self-neglect and caregiver neglect, as well as epidemiology. Review the most common observations and findings seen in neglect cases. Discuss the associated disorders. Review how a diagnosis can be made in dealing with caregiver as well as self-neglect, and review the ethical considerations involved. Okay, neglect is the failure to provide or have provided the goods or services which are needed to avoid physical harm, mental anguish, or mental illness. And this is actually a definition of caregiver neglect. An example from my own practice is I went to a personal care home, and sadly enough, it was run by a lady who had her master's in nursing. She asked me to see one of the residents that was there. He was a 70-year-old male. He had a history of hypertension and subsequently had a stroke causing global aphasia, which is where he wasn't able to communicate or talk. He had a long history of tobacco use, leading to very poor circulation, and the reason I was called out was because he had a wound on his right foot, a venous Stacey's ulcer. And clearly this didn't happen overnight. His foot was ice cold. When you checked for circulation, there was just like no blood return, and it was infected and not covered with any type of dressings or ointments. I advised the personal care home owner / manager that he needed to be taken to the hospital, and she said that since he was in prison in the past, he wasn't allowed medical treatment and that he didn't want to go anyways. So anyways, the collaborating physician I was working with at the time, of course, I called him. We get him admitted, and then several months later, after going treatment at the county hospital and transferred to the SNU, I actually happened to run into him because I had started working with Dr. Dyer at the time, and his foot was completely healed. So that's a clearly case of caregiver neglect. And here's some pictures of advanced wounds that clearly had not had appropriate treatment. And not every decubiti that you come across is associated with neglect. The frail elderly are prone to developing bed sores. But clearly when they present at this stage, you want to question the caregiver. Why did you allow it to get this far? Sorry, my throat. Overcoming a bronchitis. My throat hurts. Okay, self-neglect, when behaviors threaten one's own health or safety, and it's the refusal or failure to provide him or herself with adequate food, clothing, shelter, medications when indicated, as well as safety precautions. An example, someone that we enrolled in our study last spring, it was a referral from Adult Protective Services. Again, it was a 70-year-old male. He was living alone. The visit took place around 9 o'clock in the morning. We were on the porch. He was drinking a beer. He had a diagnosis of high blood pressure and was actually being seen by his primary care physician and was prescribed a fluid pill or diuretic to treat the high blood pressure. When I took his blood pressure, it was 160 over 90. It was clear that he wasn't taking his medication. And when I asked him, why aren't you taking his medication, his response was, I know if I take my blood pressure medication, I can't drink a beer and I'd rather drink rather than treating my high blood pressure. And I reviewed the potential complications of untreated high blood pressure, and he is aware of it, that that's what he chose to do. Sometimes it's difficult to distinguish between caregiver neglect and self-neglect. In the case of Mrs. C, she's an 84-year-old female, lives in a desolate apartment, a one-bedroom efficiency. She had no food in her refrigerator. Her apartment was infested with roaches. She didn't remember medical students coming to see her less than a week before. She answers her door completely naked. She got a 14 on her mini mental state exam, which indicates, dementia. She didn't know the time or the day. And her only living relative is a niece who has a mental illness of her own. Is only partially involved in her care and visits occasionally. So you could see how someone would say the niece is at fault for not recognizing that her aunt needs proper treatment, that the niece has mental health disorder of her own. Dr. Dyer reviewed this slide earlier this morning, that basically it's the number of allegations reported in Texas in 1997. And again, the key number is on self-neglect. You see that self-neglect occurs more commonly than any other forms of elder mistreatment. And this slide illustrates that self-neglect is a phenomenon of old age. 90% of cases reported in 1997 were neglect cases, and they were in people 65 years of age and older. Now, there are several theories to understand why caregiver and self-neglect occur. The first, and Sienna kind of talked about these earlier this morning, the first is the stressed caregiver, someone who has caregiver burnout. They're just too tired to care for their loved one anymore. But the problem is they don't seek alternative treatment plans or ask for help. A family pattern of violence. Adult children who begin to abuse their frail elderly parents just as they were abused when they were children themselves. Shrinking social network, having a limited income, outliving all of your relatives, not having your neighbors around anymore. As far as the ecological theory, it postulates that there's individual, community, as well as policy problems involved in caregiver and self-neglect. An example of an individual problem is someone who develops a degenerative disease such as dementia. An example of a community problem is lacking senior services. And then an example of a policy problem is the underfunding of adult protective services. In terms of what you see on a physical exam, self-neglectors and as well as caregiver neglect victims, they often have poor personal hygiene. Their clothes are dirty, they have long matted hair, and they have a strong body odor, either from not bathing themselves, or if they have multiple uncared for animals, they may take on the odor of their animals. They often have overgrown fingernails and toenails, and that's why it's imperative when you're assessing these individuals to make sure you take off their shoes and socks. Common infestations are scabies, lice, as well as flea bites. They often have signs of malnutrition and dehydration, which include, having a dry mucous membrane, poor skin turgor, and with the frail elderly, you would want to assess their skin turgor over the sternum. Weight loss, nausea, vomiting, complaining of not having an appetite, as well as peripheral edema. They also have functional impairments. That's why it's important to assess their activities of daily living and instrumental activities of daily living. And these include things such as, are they able to bathe themselves, groom themselves, dress themselves? Are they able to manage their finances by writing out a check, using the telephone, preparing a meal? And tomorrow we'll go more into discussion of the Kells test, which assesses both of these components, and we're using it as part of our CREST battery. And then finally, they often have advanced medical diseases, such as large untreated tumors or gangrene of their toes and feet. That's why it's so important that you include an environmental assessment when you're assessing caregiver and self-neglect, because oftentimes clients will bathe themselves, or their caregiver will bathe themselves and make them look presentable when they bring them in to see their doctor, but yet they're living in shambles. A good example that we had, this lady was meant to serve as a control, a healthy community dwelling elder. She agreed to participate in our study. She's actually a patient of Quentin Meese, but she's not seen on the geriatric floor. She's seen by another department. Anyways, we go out to her home, and the whole living room was stacked with boxes from floor to ceiling. And literally the walkway from the living room, the front door to her kitchen was maybe this wide, where I had to turn sideways to get through. The problem with this is, for one, it's a safety hazard, but the lady has poor or uncontrolled diabetes to the point where she has bilateral prostheses. And the boxes are, there's so many that she didn't have access to her electricity to turn on the light or to turn on her air condition. This visit took place last summer, like the end of July, when it's super hot. And the only place we could sit was a small area between the living room and the kitchen. It was me, my research assistant, and the patient, and she had these fold-out stools that maybe were that wide. And we're all three huddled in the dark. And my research assistant had been asked, do you have an air conditioner? And she's like, yeah, it's in the window behind those boxes. And he was like, would you like me to move them so we can turn it on? And she said no. And her neighbor actually came over and said he tried several times to help her remove the boxes, but she believes that when she gets better, that she's going to go through and sort the boxes out and get rid of them. So my point is when we came over there, she admitted that she took a bath and put on her wig and dentures because she knew we were going to come see her, and that's what they do when they come to the doctor. So it's important, if you can, to do an environmental assessment. You often find locks on the cabinets, especially with caregiver neglect. They lock the refrigerator so that they don't have access to food. They have inadequate food supplies, either expired food or no food at all. They lack assistive devices such as a cane or walker. You often find multiple drugs from different doctors. Unpaid bills, and then fecal matter, either their own feces on themselves in the floor, or if they have several uncared for animals, you'll see animal feces on the floor, or you could see both. Yeah, this was a cross-sectional study of 76 elderly persons reported for self-neglect who were felt by APS to not need a medical evaluation. And here are the results. 90% of these had at least one medical condition. 41% had a positive MMSE indicating some form of dementia, and half of them had a positive geriatric depression scale score. And then this was a study conducted by Dr. Dyer, a case control study. There was 45 self-neglectors, and compared to 97 people who were referred to the geriatrics team for reasons other than neglect. And the only significant finding was that men were more commonly found in the no neglect group, and there were no statistically significant findings between age, the ability to perform ADLs or IADLs between the two groups. Then we also looked at 5 common diagnoses: congestive heart failure, high blood pressure, diabetes, depression, and dementia. And only depression and dementia were statistically significant. So we conclude, and this was back in 1997 with the Texas database, that depression and dementia are significant risk factors for neglect cases. And then in our experiences, we found that these are the most common diagnoses associated with neglect. And you can see the huge portion that suffer from depression. Then dementia is common, as I previously mentioned, alcohol abuse, psychosis, and then executive dysfunction. In terms of having multiple allegations, 51% had 1, but then you can see there are several that have 2, 3, 4, and 5 allegations, and multiple allegations include maybe having sexual abuse as well as financial exploitation at the same time. In terms of having multiple allegations, the analysis we did showed that these, the factors listed on this page, are not associated with multiple allegations. However, multiple allegations were associated with having sexual abuse or exploitation, medical neglect, as well as physical abuse. Dr. Royale went in length with hoarding, but it is a common behavior in self-neglect. And it typically follows 3 patterns: someone with a lifelong mental illness, those occurring in the frail elderly, as well as those having Diogenes syndrome. And I have a great example of a lady we recently saw with Diogenes syndrome who also hoarded. She actually she's 68 years old. She lives alone, just as Dr. Royale was discussing, as far as having certain factors associated with this disorder. But she has her master's in library science and worked as a librarian for Houston Independent School District. And when we went out to go enroll her in our study, APS had already initiated the cleanup. And so we walked into a living room that smelled very badly. We didn't know why she was reported to APS, because the way our study works is we'll get APS will refer a validated case of self-neglect to CREST, and then we have an APS caseworker who will then go out and have them sign a release form saying it's okay for Baylor researchers to call them. That form will be faxed to me, and then I'll call and set up the visit. So oftentimes I just have their name and address. So I don't know any history about them until I get there. So every visit's like a surprise. But anyways, we walk in, and she's very strong odor in her living room. She had blue carpet that was covered in dark brown stains. There was a few boxes in the living room kind of off to the side. And as I was sitting down to talk to her about the study and consent to her, like gnats were constantly, well, actually through the whole visit, just flying and jumping in my hair, landing on my face. But anyways, it turns out that she was hoarding boxes. And APS had removed most of them, but I was like, what were in those boxes that caused the carpet to be stained so badly? And she's like, Sabrina, I told you I had 7 cats. And I was like, gross. Because it's just like 7 years of cat feces in the carpet. For an hour and a half, I'm at her house doing a battery, just thinking about it. But anyways, very well educated. She got a 1 on the exit, which means she passed, a 0 on the GDS. She passed the clocks 1 and 2, passed the Kells, and during the visit, her home is so filthy that she said that Starbucks has the cleanest bathroom in Houston, that she visits daily. After she uses the bathroom there, she'll go and pick out a mystery novel, and on the way out, grab a Starbucks. But I asked her when this all started, and it happened 7 years ago when her health started to decline rapidly. But the problem is she lived that way, but she was on the teacher retirement system making several $1,000s a month in retirement, but she could have asked for help if she couldn't do it herself instead of getting to the point where APS was involved. But it's so interesting that when we left, she said, Sabrina, I almost didn't let y'all come out, but the caseworker came back to talk to me about the study. And the reason I finally agreed to it is because I want you to find the etiology, any interventions and ways we can prevent this from happening to other people. So I told Dr. Dyer that she should be on one of our committees. Anyway, this is a picture of someone living in squalor. And then here's a picture of someone hoarding, and you just see, again, they're collecting things that they no longer need. In terms of diagnoses, you want to make sure you assess their capacity, their functional status, definitely cognition and affect, and then look into their social support system. As far as ethical considerations, autonomy should be preserved in patients with capacity, and those without should be protected. A lady, again, that we enrolled last year in our study, I think she was like 90 years old, and she lived alone. She outlived like 3 husbands, never had kids, was the only child, so she didn't have anyone. When I went out there, she has a history of high blood pressure, and part of the CREST battery that we do a comprehensive nutritional assessment developed by NASA. And part of the blood is analyzed when we get back to Quentin East, and then the rest is processed and frozen and later shipped to NASA for them to do their analysis. But when we got back to the office, her potassium was 2.3. And she was on Cager, a potassium supplement, but obviously she wasn't taking it. So I called her and said, you've got to go to the hospital right now. And she was like, no, Sabrina, I feel fine. I'll just take another potassium. And I was like, no, you've got to go to the hospital now. She still refused to go, but she said she felt fine. I called the caseworker, and luckily she lived close to the Houston office. The caseworker just stopped by her house, again tried to convince her to go to the hospital. She continued to refuse, and finally we just called the paramedics and she was admitted. So she clearly couldn't understand the consequences of not having her potassium normalized, or not to leave it untreated. As far as caregivers may lack the skills or resources or information necessary to complete the task. They also may have an impairment themselves. Regardless of the circumstances of the caregiver, it's actually mandated in the state of Texas that you report the caregiver for caregiver neglect to Adult Protective Services. Then clinicians also need to think about is if there is caregiver neglect, not only do you have to report it, but you also have to find a separate caregiver or alternative placement for the client. And then when considering an intervention plan, it's important to focus on safety, autonomy, and in some cases both. You want to ask our elders personal choices being considered. And then finally, is the cure worse than the disease? So in conclusion, neglect is the most common type of mistreatment. It's usually more difficult to diagnose, and capacity and autonomy are important ethical issues in cases of elder neglect. Do y'all have any questions? Yes.
The woman who was the librarian, the example you gave, could you have come into her home without her allowing you to come into her home, and we did all this cognitive assessment?
No. She had to sign the release form for me to contact her. That's part of the IRB approval that we have. And like I said, when the caseworker first talked to her about participating in this study, she refused. And then when she went back, she agreed to participate.
I had a question just about the issue of how the caregiver themselves are trained, or how they decide who can be a caregiver to avoid, if they can, the problem that they might be neglectful. You know, we talk a lot about self-neglect, but what about the caregivers? And some of them, they say, well, they lack the skills, and I'm wondering what screening process is used to determine that.
Well, sometimes it's just a matter of a family member wanting to take on to help mom or dad. Oftentimes the providers are put in by home health agencies. And I'm not sure what type of training they have. I don't know if you can.
I could probably elaborate a little bit on that. In our elder abuse fatality review team, a lot of the cases that we have reviewed are a result of caregiver neglect, we think, alleged caregiver neglect. What happens is that with the home health agencies, or a family member can become a paid caregiver, and they have to have a certain amount of training by the company or whomever hires them. However, many times the training is not sufficient to take care of the degree of seriousness of the condition. And an example of that was in our very last fatality review meeting. An 80-something-year-old gentleman who lived with his daughter, and his wife had passed away 8 months before. The man sat in his rocking chair, refused to eat, and he starved himself to death. His daughter was his primary caretaker, but he had been the authority figure in that family, and in their culture, what father said, father did not want to eat, he did not want to drink, he refused any intervention by them. They did not know what to do, so as a result, he starved himself to death. And many times we find that it's the lack of caregiver training or insufficient training, particularly when they're paid caregivers and the expectation is that they will know what they're doing.
I just want to add to it because I'm just thinking about an interesting example. We just had a patient come to the clinic a couple of weeks ago, and this was a lady apparently who lives with her brother, never been married, no children, white female, originally from Iraq, lives here with her brother, who's a pharmacist. The brother has been the caregiver. She's lived with him for several years. Her mother used to take care of her. The mother died, so the brother was the only one here. And the person who approached us is the brother who came from out of state with his wife, because apparently things have gotten so bad in her condition that this patient becoming very paranoid, very suspicious, poor personal care, poor personal hygiene, and the brother locally who's living here with her is just ignoring, denying, just dismissing any kind of issues. This guy's an educated person. He works as a pharmacist, but apparently he lives his life, and she is basically locked in her room. And if she prepares her meals, that's fine. Apparently, when she lived in Iraq, she was diagnosed with schizophrenia, and she was getting her medications. When she moved down here with her mother, parents, the uncle and aunt would ship the medications to U.S. Well, the uncle and aunts somehow had to relocate. They were out of the picture. The brother here, the pharmacist, didn't think there was an issue, didn't think that she needed anything, so basically just let it go. So she was without medications, and over several months, and probably a year, the brother from out of state who would be calling and getting some bits of information was concerned enough that he finally said, if he doesn't do anything, we need to come down here. So as a result of him coming to our clinic, bringing his sister to the clinic. I mean, if you talk to the person, she was well educated. She presented herself very well, but had poor personal care and hygiene. She refused to take a bath now for months because she felt that someone was watching over her, and she was afraid to go into the tub. And apparently the brother later on, because he came, second visit, the local brother brought his sister to the clinic, and I had the opportunity just to take him aside and just talk a little about trying to see where he's at. That he said she's been refusing and been so resistant that he just basically gave up, just didn't have couldn't work with her because she was so resistant. So I think at times it's just the situation is overbearing, and with psychiatric illnesses or other issues, drugs, alcohol abuse, caregivers are just having such a hard time dealing and breaking through until someone else breaks them.
We had a case where the two daughters were caring for the mother. One of the daughters was a licensed nurse. The other daughter was a paid caregiver, getting paid to take care of mom. They neglected mom to death, okay? And the pictures were some of the worst that I had ever seen. And they were looked at criminally to be prosecuted, so they hired a lawyer. I sat down with them and their attorney, and I showed the attorney the pictures. He hadn't even seen them yet, that the APS caseworker had taken. And I could see this man literally turn green. He had no idea how bad they had neglected her. And he turned to them in this meeting and he said, how could you not have known to send your mother to the hospital with gaping wounds that went all the way to her bone? Okay? I don't know why. The nurse no longer is a licensed nurse. There was never prosecuted criminally, but it could have been, in my opinion, because the daughter was receiving money.
Are the post-test questions? Self-neglect makes up what percentage of elder mistreatment? I'm going to get back and answer this. Okay, question 2, which is
And she said, could I change the lecture in the book a little bit? And we said, of course you can. And of course, I improperly downloaded her presentation, so she does not have it with her, which is entirely my doing. So Barbara will probably never come back and speak with us again, but I bet she will. I hope she will.
So we also have a grant from the Administration on Aging to do a program, a Senior Medicare Patrol Project. There's 2 in the state of Texas, one that we have in Houston, one is down in the Valley. And basically what we do is we educate people about Medicare fraud and then try to get older adults to report Medicare fraud or suspicions. And that's how we continue to get involved with older adults. We were at the National Conference on Aging and we went to a session on preying on elders, financial abuse, and they showed this 60-minute tape from 2 years ago, from June of '05. And so it's wanted to kind of show it because it gives you a good illustration of actually scams and what happens on there, and it'll show you, and we can look at it later on. We can talk about a little bit about the 5 older adults that it actually shows in there and how you can see how some of them interact.
Here, 1 out of 3 adults in the United States gets a call from a con man, and the very best in the business of telemarketing fraud are known in the con game as the closers, the smooth, persuasive talkers who convince people to send them millions of dollars based on a phone conversation. For a while now, the most talented closers in the business have been working on something called the Canadian lottery scam, one of the largest, most successful cons ever. Authorities believe that variations of it have been used to swindle American victims, most of them retirees and widows, out of as much as $5 billion. This is how it works. You get a call from someone saying you've just won a huge amount of money in a Canadian sweepstakes. The money will be delivered just as soon as the taxes are paid on the winnings. Sound pretty good? Well, it sounds even better when you hear it from the closer. You make your living ripping off the little ladies.
Little ladies and men. Both. I wasn't sexist that way.
Taking advantage of their trust.
Yes. Finding their weaknesses and exploiting them.
He called himself William Foley and told people that he was a lawyer. That's not his real name, and he's actually a former bouncer at a strip club. We met him in Montreal, which is ground zero for the Canadian lottery scam because of the light sentences handed out for telemarketing fraud in Canada. Foley was there awaiting sentencing after pleading guilty in the U.S. to defrauding people in 24 states. He's now cooperating with authorities. As far as con men go, how would you rate yourself?
That was one of the best there was at conning people out of their life savings over telephone.
How much money over the years have you coaxed out of the pockets or bank accounts?
Millions.
Right.
Millions. I'm currently awaiting sentencing on federal charges for my crimes. And in a 9-month period, they estimate $7 million US, and that's in 9 months. I've been doing this since 1995. I always wasn't as good as I was now, but I would have to say 30, 40, $50 million perhaps I've coaxed out of people's pockets.
He did it by playing on the American dream of instant wealth, using kindness and patience to insinuate himself into the lives of elderly and lonely people.
I developed rapport with my customers. I called them my clients, who were really the victims. I spoke to them every day.
Good morning, Mr. Giddings. In this call, recorded by the Royal Canadian Mounted Police with victim Elvin Giddings of Terry, Mississippi, you can hear the friendly banter.
Well, hi. Oh, I was talking to you yesterday. How are you?
I'm good, thanks. Yourself?
Are you finally feeling better?
I'm a bit stuffed up, but I am feeling much better than I was a couple of days ago.
I had to make the person on the other end of the phone feel like they were sitting in my office, but in a much smaller chair on the other side of the desk, and I was the one who controlled their destiny.
So we have to pay them back. And we filed bankruptcy, and we were almost to lose our house. It was going into foreclose.
What kind of an impact does this have on your life?
Well, I went to the hospital in February, stayed in there 3 months, had a nervous breakdown. They were the most convincing people I have ever heard talk.
Guess who the Texans are?
That's me. And it was real.
Dalton Bissett and Willette Miller are both from Texas. She was warned by her banker not to send any money, but she did it anyway.
I'm mad now, and I'll do anything if I could save one person $1 out of all this scam business.
What she decided to do was to lend her name and face to a statewide public service campaign to warn others about the Canadian lottery scam. It's called Just Hang Up, but it's not that easy. When people come to your office,
I don't think that lasted very long because I didn't see much about it.
Even after we provide them a detailed explanation of how it's a scam, they'll turn around and give more money to these scammers.
If you get one of those calls, just hang up.
Okay. So you can see that, I'll close this down. You can hook up the slides if you want to. So a lot of the things that were talked about earlier, they focus on things like people tend to think of families in regards to financial exploitation. But you can really see that it's really a big, big problem as far as scams go. And it's getting worse instead of better because there's a lot of things that kind of throw people off. Just recently, the Medicare Part D, they take that ploy and they call people up and they tell them they're with Medicare and they need to enroll in a plan. And then they need their personal information or they need their bank routing number. I had to kind of laugh. You could do the slides. The thing they passed out, they asked you to fill out, and it says, it's okay, you put your last 4 digits of your number. Well, that's certainly debatable. Yes, they can't find out maybe the whole world about that, but people can take that information and they can make you feel like they have all your personal information, and therefore you give them other information. And for older adults who are sitting at home and alone and they answer the telephone and they always answer the phone, that's the biggest problem. And that's what leads into it, is they're lonely and they're home alone and they want someone to talk to. This guy's nice. He asked her, she knows he had a cold. Probably asked about those grandkids. They do all kinds of things like that. And they'll call them up nowadays. They'll tell them, your personal information's out there on the internet. And they'll give them some of that personal information, maybe the last 4 digits of their social security number, maybe a part of their bank account number. So that freaks them out. And then they sign up for $199 to get their information off the internet. Now, we all know that's not possible. But you're dealing with the high-tech world, and a lot of people are extremely confused by it. So it's easy for them to kind of get waylaid. But since he's doing that, we'll get back in and we'll do something like this, and we'll talk about some of the examples and stuff. Let me see. What have I got? Not too much time left after that. Mostly we talk about, these slides, they talk about check fraud. Well, check fraud in relation to family members or caregivers in your home stealing your checks out of them and writing them, not letting them know. Some things, way people never know about them is they don't read their bank statements. Now, I always tell people when we go out in conversations is that I'm not telling you to balance your checkbook, and I'm not telling you you have to balance your checkbook. What I'm telling you is you need to read your statement to make sure that things look right, that you don't see unusual withdrawals, that you don't see checks that are out of sequential order, that don't make sense in the amounts. Those are important because people will nickel and dime people to death too. You know, they don't have to wipe out. You hear those stories where you wake up and every bit thing in your bank account's gone. But also they'll take $50, they'll take $75, they'll take just enough to stay under the radar for everyone involved. So you have to be very careful about that. Check fraud also, you know, people stealing checks, ordering, they steal. Maybe today, I do most of my banking online, which I do find much easier, and I'm more confident because I can track it better than you can. But when you order those checks and they come to your house in the mail, well, they get stolen all the time. And even people, we tell people maybe pick them up at the bank. But then I have people tell me they picked them up at the bank and somebody still stole a packet out in the middle. I mean, the only way you're ever going to know if the check doesn't get stolen is to open up every box, look to every stack, and look at every number, and then you'll know. Credit card fraud. People can steal all those things. You know, a lot of older adults living in housing facilities or living in apartment complexes. I'll tell you, all you have to do is go to the trash box, and you'll find those things just thrown out. They don't take them, they don't shred them. And everybody, including you and them, everyone should own a shredder. And then you should use your shredder. You know, sometimes people don't, I didn't use it. But then when I talked to the cop who says he got, he's seen people get applications when they've just been torn up and taped back together, then you think about doing that. People get very frustrated about getting all those offers in the mail. And we give people information on how to stop that. You know, you can call the credit bureaus and ask your name to be taken off those lists where they pass on that information, to be very careful. But that's easy for family members to steal things. It's easy for everybody to steal those. Another type, I don't think it's necessarily fraud, but it's definitely abuse by family members, is when parents and grandparents give their children and their grandchildren access to their credit cards because they know they have problems. You were talking about buying the food. And then they're stuck with the bill. And sometimes you talk about a group of people who really treasure their good credit rating. And so it upsets them that they may have bad credit rating. I tell them, are you buying a house anytime soon? They go, no. I said, the hell with it, don't worry about it. You know, you're at that point in life that a credit rating isn't going to do any difference for you. But older adults are the largest, fastest growing group of people filing bankruptcy and going into credit card debt. And they go into credit card debt because they can't pay their medication bills, they get car repair problems, they get all kinds of particular issues that they start relying on these offers that they get in the mail that they never used when they were working. They don't know how to use credit appropriately, and they misuse it, and then they get very depressed and get very stressed out. Suicide, high suicide rates over people who get financially exploited or get into financial problems. Embezzlement. In the module, in the slides, he defined embezzlement strictly mainly through guardianships and attorneys and family members and caregivers. We're extremely, extremely leery when we hear someone who calls us and has an appointment with a certified senior advisor, financial advisor. There is no real thing as a certified senior financial advisor. There's no course that you take credit course. It's not like a licensed social worker or some other kind of license that you get. This is sort of a certificate that somebody kind of dreamed up that you can have. That doesn't mean that they don't have good intentions, but it also doesn't mean they have the best of intentions. They're selling products that really don't benefits them, not the beneficiary. So these things are always very scary that people are willing to do that. There was a while in Texas, there was a big thing going on a few years ago about trust, trying to sell people trust. In Texas, it's real easy to probate a will. You don't need a fancy trust unless you have like $1 million estate. And I got my attorney over here nodding about that. Well, the only way we got rid of those people is that only an attorney can do a trust. So when you go, I forget what it's called, the unauthorized law practice thing. So that's how they got some of those people go out of here. But still, they keep coming back and coming back. So it's really scary. Con schemes, that's exactly what we're talking about, primarily with the gentleman on the show, the Canadian lottery. But they come back in so many different ways. Like I talked about the Medicare prescription drug coverage, your name on the internet. There's always something, now we have older adults who really don't use the internet except for email. So, but they get all these scammy emails, and they can be scary. You know, when you get an email that says your credit, you know, your account's been compromised, you know, click here and go there. Well, they do, because they don't know that they're not supposed to, and they don't understand the parameters of doing that. So there's always people like Mr. Foley that are constantly out there looking to take advantage of people. And I think there isn't enough attention paid to financial exploitation in this manner, and I don't think laws are strong enough to really get to them. And so, I might hit on that in a minute. This is inside your, we don't need to go over this, this is really in your modules. You have all these statistics and numbers, and I don't need to read to you what you can read on your own, since we're almost out of time. But the thing to remember is that I feel that most people, they do live independently. I think a lot of people are living alone. They're lonely, and so that's why they respond to these. I hear from so many people who tell me that I got this telephone call, well, quit answering the phone. Well, but it might be someone I want to talk to. Well, you know, if every family got your parents a answering machine and showed them how to use that, you know, you may be able to avoid some of these calls. But they're scared they're going to miss something important, so they answer the phone and they're lonely and they'll talk to the people. They are largely white, but what I see a lot of, that's for check fraud. I will tell you now, what I see going on in Houston a lot, and I think we barely hit the tip of the iceberg, is in low-income neighborhoods and with home repair scams. And maybe you have those here. They put out those darn signs, you know, call, and you're dealing with people whose houses are literally falling apart, and nothing will, I mean, they can't be repaired. They really cannot be repaired. And they wouldn't qualify for a reverse mortgage. But it's amazing how someone can come in. Now, if you've ever gotten any type of home repair done, you know, someone that gives you an estimate, they show you what the materials are, they tell you how much the labor is, and it goes into detail. Now, how can someone walk into a house, walk around for about maybe 15 minutes and sit down and go, okay, it's going to cost $27,000 to fix your house. And here, sign this piece of paper and sign this one, and we'll get you a loan and we'll get you going. And this other gentleman who just backed us some stuff from, I forgot, he lives down in Missouri County. He signed off on the completion certificate. So he signed it, and the job's not done. And I asked him, why did you sign it? Well, he tricked me. He told me he needed the money to pay the person. And now he's stuck with a $27,000 loan on a house that's probably not even worth $20,000 or $15,000 with the percentage, and yet he has all the signed contracts. That's a problem when you've signed your name on a contract that you're obligated to. So how do we continue to try to find these and prosecute these? It's very difficult. District attorneys aren't that interested in going after one person. You know, no one wants to do it. In the day of terrorism and corporate fraud, they go after these big guys and all this big money, and nobody cares about this little person who's lost $27,000, $50,000. That's sad, and that's what needs to change. And hopefully in time we can. Kind of flipping through these. Here's your victim profile. Usually, like we said, they're widowed, alone. They are more often white, but I find the low-income neighborhoods with the loans, you know, they're just stuck with a high percentage loan and paying each month. Oftentimes, these are all people who have income of some kind. You know, they're not, even if it's Social Security, oftentimes a pension, and where they feel that they can pay for that. This slide, I think they mostly live alone. He says they live with someone else, so I don't necessarily agree with that. But this was the study for this one. Signs, we talk about inability to pay bills or meet day-to-day expenses, you know, when they should be able to. Unexplained or sudden withdrawals of funds. This is what kind of gets you, is that the banks, now there's some more teeth that have been given to them within the Adult Protective Services in relation to the banks stopping people, but still not strong enough. But in the past, a few years ago, a gentleman told me how a lady came and took $30,000 and sent it to Canada. No one at the bank said a word to her. The next day, she came back and wanted to send $40,000. So then they got involved. They got her daughter there, got it all stopped because it hadn't been 24 hours. They got the other money back, luckily, but somebody was there to stop her. And when we go out and we do education, we have a little brochure. It's called Protect Your Assets While You Still Can. And what we do is we try to encourage, I tell people, 2 things that are hard for your children to do. 1, take away the car keys, and 2, take away the checkbook. You know, and if you want to protect yourself while you're still able, you need to set all that in motion. Get a trusted person, family, child, you know, an attorney who can be the second payer on them. We had someone from Catholic Charities call us, and we talked to this lady and told her about the Canadian, just like Greg Abbott said. You know, we tell them and they still do it. She was still sending money. She told us, well, he said if my money's stuck in Dallas. We said, look, we'll drive you to Dallas to get your money if that's what it takes. She chose to believe him and not us. So, you know, I'm sure she's lost every penny she had in that regard. So we need better banking laws in that regard. If there's disparity between stated assets and living conditions, for instance, they live in a fancy neighborhood but have no money. You know, where did it all go? And that's happened recently. To once again, the Royal Canadian Police called my boss, and they were working together. This lady wouldn't even answer the door, and finally we found a retired FBI volunteer who went over there. It was the first person that she would actually discuss this with, because they're embarrassed and they don't want to feel like they can't live independently. Now here we go. Lack of receptivity to a necessary intervention that requires payment when finances should not be a problem. And then extraordinary interest by others in the client's assets or will. I call this back to those guys out there selling a trust. You know, that's why I don't trust them. Okay, your posed questions, I'm not going to read them to you. You're all old enough to read, right? And that's all I have to say quickly. But any questions or experiences? You know, yes, ma'am.
Just real quick, I met one of my patient's family members recently, and they were having a problem with the things coming in the mail or the phone calls. And this was a fortunate situation. The daughter would have the phone rolled over to her cell phone number whenever she was not home with her father. So I thought that was just a helpful little tip. Most people don't have that, but something that can happen is to have phones forwarded to her.
That's good. Sneak in there and forward it to her without her knowing you're doing it. That's a great idea. Well, you know, I talked about the sweepstakes. I can guarantee you if someone's come in calling me and saying they're getting lots of sweepstakes or they bring in all these things, first thing I say is, you've been replying to them, haven't you? You know how many years I used to do the what do you call it? Publishers Clearinghouse. You know, I don't buy anything, but I'd send it. You don't have to buy anything, right? So I send it back in. Well, I don't get them anymore because I finally stopped doing that. But you know how many years it took for that to stop happening? So if you're getting these phone calls, even when I get a second phone call from someone who hasn't yet, according to them, hasn't given any personal information, and I said, but you got a second phone call? Then that means you talk to them about something and you need to stop talking to them. Because if you respond to anything in the mail or respond to anyone on the telephone, they are going to keep coming back at you. Just like they said, they start called a reload room. You know, they're going to go back, they're going to call that lady up from Mississippi and go, we can get your $70,000 back, but it's going to cost you this. Yes, ma'am.
You know, one other thing you can do is put on the answering machine. You know, if you're selling something, we don't want any. If you're a telemarketer, we're on the Texas do not call list, do not call again. I have all that on my mother's phone on the answering machine. So if she doesn't get that call, they get that very strong message.
That's true, but that's a legitimate telemarketer. We're talking about people who aren't legitimate.
Right.
And so they're not going to pay attention to that and they're going to call back. So legitimate telemarketers, when you say, please take me off your list, I'm on the do not call list, they have to do it because if you record, keep calling it back, you report it to PUC and they get in trouble. But a scam artist is going to keep coming back if they can. Barbara?
I think we're seeing some correlation between self-neglect, hoarding, and repeatedly going after these sweepstakes. And I've seen cases where go into the hoarding and the house is filled, and it's filled with sweepstakes things.
I know, I'm glad you brought that up, yeah, because that's why I said, you'll hear people, when Aunt Tilly died, we found, a whole room full of boxes, from little trinkets they spent. I went to a lady's house one time, and this was sort of an intervention, I think she had us come over, because she had a stack about this tall ones, and in each corner she had written how much money her money orders would be. It was like $465, and she's doing that almost a weekly basis. Just like that lady, they didn't ask the woman from Mississippi how much money she spent on sweepstakes. They just talked about this other thing. I can't imagine if she was entering those things all the time, what it would be like. So, without a doubt, within the abuse system, it is very family, oriented, and that's a big portion of it by family members. But I hear from more on my end are people who are continually taken by outsiders and by people over the telephone, and that's the scary part. And you just have to tell, the rule of thumb, if it's too good to be true, it's too good to be true. And there's no such thing as a free lunch. And if you can get them to repeat those to themselves, then they'll do pretty well, hopefully. Somebody else have your hand up?
Well,
Yes, ma'am.
I was just going to mention that I take care of my mother, and I had last year, at the end of last year, I had some furniture, her old furniture, not really special, but just old furniture I wanted just to keep because it was hers, and I had it sent out to be redone. Well, he wanted half, and I thought, well, I had the money before I spent it on something else. That's fine, He had it in a local address, so I gave him $1,000 on the furniture. Well, when he came to deliver it, he hadn't done anything and still wanted the other half.
Yep.
And I said, no. And he says, well, I'm going to call the police if you don't give me the money. I said, good, call the police. I want them here so they can see that you didn't do anything to the furniture. And he packed everything back up in the truck and left. So I went and made a report. And I said, what do I do? And he said, the police station had said that the state does have some kind of agency where the state attorney general wants to go after these people who are affecting the elderly and the disabled. So he's got double whammy here.
Yeah.
Disabled and mother. And so, that's what I have to go. He's got the furniture and $1,000 and doesn't answer the phone.
Yeah,
So-
you never pay anyone in advance for anything. And that's what you get with these people all the time that come and do home repair or do all kinds of things for older adults, is they tell them they need the money, they need half the money. I need to buy supplies, blah, 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 and then they come back and they need to pay their people, and then pretty soon they're kind of dribbling down the whole amount, and they never finish the job. You pay anyone in advance, and I will guarantee you they will never finish the job. I've never met one person in 5 years who paid anyone in advance and got a finished job. It does not work that way. If they need money in advance because they have to pay their people or they have to buy supplies, they're not credible to start with, because anyone who has good employees can pay them. Anyone who can buy supplies, they have an account down at Home Depot because they have it because they're legitimate, reliable business people. So no one pays anything in advance. And that happens, especially a lot of older adults. Christian, anything in the Christian, and I laugh. I said, look, just because they pray over the job doesn't mean they're going to do a good job, and they still don't deserve the money that you pay them. And but they're Christian and they're nice and they're this, or the minister referred them to them. All kinds of stories. I mean, it just goes on and on and on, and it doesn't stop. And